Measles by Alessia. What are measles? Measles is a very contagious respiratory infection that is caused by morbillivirus. The virus dwells in the mucus of an infected person's nose and throat. Why is measles a problem? Measles can cause pneumonia and encephalitis, which can be fatal. Following measles infection, there is a loss of immune memory that results in immunosuppression, which raises mortality risk for up to 3 years following measles infection. Other potentially fatal complications may occur after the infection, including acute disseminated encephalomyelitis, which is a demyelinating disease that can occur 2 weeks after the infection, and a subacute sclerosing panencephalitis, which normally occurs 7 to 10 years after the infection. The morbillivirus is a 3D graphical representation of spherical shaped. It is a single-stranded RNA virus, and it is 120 to 225 nm in diameter. Where do you find this virus? The measles virus lives in the nose and throat mucus of an infected person. What are the symptoms? The symptoms of measles include inflamed eyes, dry coughs, high fever, rashes, runny nose, or having a sore throat. Symptoms start developing typically 10 to 12 days after exposure to an infected person, and the symptoms last 7 to 10 days. The initial symptoms normally include fever, coughs, runny nose, inflamed eyes, and sore throat. After 2 to 3 days after the beginning of symptoms, small white spots called Koplik spots may start forming inside the mouth. 3 to 5 days after the start of symptoms, a red flat rash may start forming in the body. How does the disease spread? The disease can spread through coughing and sneezing, and a person could also get the disease by inhaling contaminated air or touching an infected surface and then touching their eyes, nose, and mouth. How do you protect yourself from measles? The best way that a person can protect against measles is by getting that vaccine called MMR vaccine. Not only does it protect you from measles, but it also protects you from mumps and rubella. Who discovered measles? A Scottish physician called Francis Hone demonstrated in 1957 that measles is caused by an infectious agent in the blood of patients. Where in the world has it affected people now and in the past? In the past, it affected people in the Middle East, and then when people started treating, the disease started spreading worldwide. Before the vaccine, it was estimated that there were going to be at least 12,000 measles-related deaths each year, and up to 4 million people were infected yearly. Now, measles can be found in the developing areas of Africa and Asia. Right now, measles outbreaks are happening in every region of the world. They can get from place to place when an infected person travels to another country and then people get infected. In what ways is science used to address measles and how effective is it? The scale of measles cases has been increasing since 2014 when there was a worldwide outbreak of the disease. This increase in cases is caused due to a decrease in vaccination rates. People decide not to vaccinate their children because of their religious or personal beliefs, and it puts their children at risk for getting this disease. People also claim that the vaccines may cause secondary effects. The event provoked public and scientific interest. Research has been done on vaccines to show that they do not have any secondary effects. They reviewed the pathophysiology of measles infection, focusing on mechanisms. They paid close attention to special groups that are more liable to a typical or severe measles. The overview of microbiology, symptoms, diagnosis, prevention, and treatment enhances and completes the review. The vaccine is very effective since it prevents measles disease by strengthening the immune system response by exposing the immune system to antigens, and the antigens teach the body's immune system to recognize and kill the disease. What are the implications of the use of science interacting with economics? The average cash price of the MMR vaccine is $113.54. Two doses are recommended with the price of $22.11 each. Not all governments pay for the vaccine, but most health insurance plans cover the cost of vaccines. What are the implications of the use of science interacting with society? Everyone should get the measles vaccine except for people with immune system problems or a person in which parent, sister, or brother has a history with immune system problems. Also, if someone is allergic to an MMR component, they shouldn't get the vaccine. By receiving the MMR vaccine, it allows people to live a normal life and to be able to interact with each other without danger of getting measles. But a lot of people decide to stop giving their kids the MMR vaccine because of their thoughts and beliefs about the vaccine. So because of that, they put their children and other people at risk of getting measles. In results, receiving the vaccine has a positive impact in society, and by not getting the vaccine, it gives a negative impact to society.